Some news now on Senator John Fetterman of Pennsylvania, who's receiving treatment for clinical depression at Walter Reed National Military Medical Center. His chief of staff says the senator checked himself into the hospital on Wednesday night, writing in a statement, while John has experienced depression off and on throughout his life, it only became severe in recent weeks. Fetterman suffered a stroke last year while campaigning in a highly competitive Senate race. He was hospitalized last week after he felt lightheaded, but his staff says tests ruled out another stroke. Fetterman's wife posted on Twitter, after what he's been through in the past year, there's probably no one who wanted to talk about his own health less than John. I'm so proud of him for asking for help and getting the care he needs. Several senators also posted messages online supporting him. Joining us now, NBC News correspondent Dasha Burns. Dasha extensively covered the 2022 Senate race in Pennsylvania between Fetterman and Dr. Oz. Dasha, what more do we know about his condition and how long he will be in the hospital?
Well, Mika, first, I have to say, having covered Fetterman now for over a year, I know him. I know his family. I got to know his staff during this process. They're all incredibly close. And it's been really difficult to watch them go through this, to continue to go through this. And, you know, anyone who has ever experienced severe depression, myself included, by the way, knows how important it is to go and seek help, but also how incredibly hard it is to do that, especially when you're in the public eye like this. So I'm just glad he is where he needs to be and he's getting the care that he needs. But you asked some important questions about the latest and about the timeline here. I did speak to a close senior aide of his last night, and he said that we're looking at not days, but also not months. So most likely weeks that Senator Fetterman will be in inpatient care. Again, likely a few weeks that he'll be in inpatient care for clinical depression. According to this aide, the doctors are trying different medications. It'll take some time to ramp up the dosages. He'll need time for, observation and any adjustments that he needs. The aide also tells me that both the staff and Fetterman himself were surprised by the severity of the depression, by this onset. There was a feeling internally, according to the aide, that after this hard-fought victory after the midterms, he'd have some time to, rest, to recover before being sworn in. But depression just doesn't follow that kind of timeline. And the aide says for those around him that it's been sort of difficult to distinguish the symptoms of the stroke from symptoms of depression, saying that sometimes, it's hard to know if he's not hearing you or if he's just sort of being crippled by depression and social anxiety. And so there's a sense of relief on the team that they're now able to sort of address this depression issue that's been so complicated in the context of the stroke and everything else that's been going on with the senator. So you mentioned the hospital visit last week. I was told by the aide that the doctors there recommended that he seek outpatient care for mental health. And then on Monday, he saw Dr. Moynihan, who told him that he needs inpatient care, that this is severe enough that he should take some time to take care of himself, checked himself in, and now, like I said, we're looking at likely a few weeks. And just a little bit more context that he told me based on some of those conversations, just describe the challenges with adjusting to this new reality post-stroke. And, we saw that even in our interview back in October, Fetterman telling us that everything had changed after the stroke, conversations with his family, with his staff. You can imagine how difficult that can be.